Welcome to yet another exciting episode of Inside Abuja, the program that keeps you updated on issues in the Federal Capital Territory, Abuja. I am Podlu David. Now, the foundation of success in life and basis of happiness is good health. As the saying goes, health is wealth. Now, a person cannot effectively build fortune when he or she is sick. The other thing that many people do not value good health until sickness comes. Now, we all expect to be strong and vibrant all the time, but sometimes sickness is inevitable. Now, if there's anything more frightening than falling sick, it's not having money to pay for healthcare when sickness sets in. Today on the program, we will be looking at the FCT health insurance scheme. Now, health insurance ideally helps protect the person from the high cost of healthcare and help pay for the doctor's visits, hospital stays, prescription drugs, and important preventive care. Now, what are the processes, what are the rules, and everything else that one needs to know about the health insurance scheme in the FCT? Let's take a look at this report and find out. Over the years, healthcare systems in many developing countries, including Nigeria, have failed to provide its population with quality and affordable health services. Poor public health services and the ever-rising cost of healthcare not only expose large sections of the society to risks, they further impoverish an already deprived population, condemning them to funding healthcare needs through out-of-pocket payments. Experts insist that an earnest move towards health insurance schemes for healthcare financing remains the best way to reduce the burden of out-of-pocket payments. The FCT is not left out of the effort to attain universal coverage.
Insurance is targeted to remove the out-of-pocket expenses from staff and residents of FCT in general. The idea was brought about at one of the meetings of the Health Council, the National Health Council, where it was decided that all states should come up with an idea of setting up an agency that will give health insurance to all the residents. That is almost 10 years ago. However, FCT was able to commence this program at that time, and that's more than 10 years ago. And since then, we have been able to register all the FCTA staff, and currently we are embarking on the informal sector, bringing every other person involved apart from government workers.
These FCT residents testify of the benefits they enjoy from the health insurance scheme.
I was once admitted here, and for the bed field I didn't pay anything. What I paid was for the drugs. It was NHIS that covered all the days I have spent in this hospital. They were the one that foots the bill. I didn't pay for it. But what I paid was for my drugs, and even the tests I ran, they were the one that covered it for me. So I was okay with that aspect, and it favored me, because if I'm to pay, I know how much I am going to pay.
Services are okay, and the subsidization is okay. And there are drugs you may go outside to get about 500 or 2 or 3 or more than that. But when you come down to, when you use the insurance scheme, you get it at a cheaper rate. Alright, like the one they just gave me now. Maybe outside it could be up to 1,000, but I got it at 80 naira.
Some enrollees were seen at the office of the FCT Health Insurance Scheme, eagerly waiting to join those enjoying health insurance. For them, the enrolling process is not so stressful.
I was given a form, then I filled the form and submitted it with my passport and my siblings, if I have dependents, then I also registered them as well. So initially I registered myself and my wife, then I came to also include my son, my newborn. So it's relatively very easy, it's very convenient, stress-free.
No, it's not that stressful. All I did was I filled the form right from our parastatal. Since then I thought maybe they were the one to call us to come and pick the ID. But since it's like this, I have to come and pick it myself.
The program manager of the FCT Health Insurance, Ahmed Dan Fulani, sheds more light on the programs of the scheme.
We have different programs that are targeted towards enrollment of everybody. First of all, the program looks at the formal sector. The formal sector looks at public service and organized private sector. By organized private sector, I mean that any employment that has more than 10 staff, they are categorized as organized private sector. Whereas any other one that is below that, then we look at them as informal sector. For the general description of the other forms of informal sector, we have the artisans, the market women, the community people, and every other group of individual who intend to come on into the program. Under the informal sector too, we have the retiree program, we have the school health program, we have the community-based health insurance scheme, and a host of other programs like that that is targeting every other group apart from the public sector. The scheme intends to give health care to retirees free of charge. However, nothing is free anywhere in the world. We are asking them to pay a token of maybe 1,500 naira monthly, which is going to be deducted from their pension allowance. And we have commenced that in FCT, and we are in the process of enrolling all of them that is agreeing to key into the program. The formal sector, which basically comprises of the staff of FCT, they are 100% covered. Any staff of FCT that is not covered meant that the person has not come to the agency to register, because money is already made available to them. So 100% FCT staff are covered. The local government or the area council staff, we're in the process of re-engaging them because they were on the scheme before, but due to some logistics, their names were left out. But as I speak with you, we're in the process of re-enrolling all the area council staff into the scheme. Again, we are in 33 communities for the community-based health insurance scheme. There are a lot of few issues that didn't allow that program to continue. But however, we have been able to sort out all the issues surrounding that.
We spoke to the managing director of the United Healthcare, one of the health maintenance organizations, or HMOs for short, working with the health insurance scheme. He explained their part in the whole process.
We are a health maintenance organization. That means we help to maintain your health. Actually, I always tell people, if they have any case in court, it's better for them to go through their lawyer than rather than say they go to the court and you go and argue for yourself. Definitely your chances of winning is reduced. So it is now time to enlighten our people to also know that in the developed world, nobody walks and goes to his doctor. No, people go to the doctor through their health maintenance organization. Because as a health maintenance organization, we are equipped with different plans and different hospitals. We can tell you, look, how much premium can you pay? If you tell us how much premium you pay, we can tell you this is the health benefit plan that will benefit you. It will give you all the things you need. So there is a lot of transparency to it. We as the health maintenance organization, we are your best friends in that we are the one to monitor all your complaints. Customer satisfaction, if you have any problem with any of the hospitals, come to us, because we are the one going to pay those hospitals. And therefore, we are also going to monitor the quality of service that they give. You understand? So those days are gone when you get to the hospital and you are not satisfied with the quality of service you meet. If you get to any hospital and you are not satisfied, don't quarrel with them. Don't make any scene. Just call your HMO. And that is why most of the cards now, health card they give you will see that the name of the HMO and the number of the HMO will be at the back so that you can call them.
Some enrollees at the Gariki Hospital were discontent and seemed not to know the responsibility of the HMOs. They speak on some of the challenges they are facing.
Some of the area of the service that are really not treating us well. As you can see, we have been here for some people have been here for more than 3 hours. Some people have been here since morning waiting for an approval code, and we are yet to receive it. And without it, you cannot go further to do any other thing. You can come sometimes even 4 hours, you are here waiting for just a code before you can proceed with your treatment. So in that service, they need improvement because we are not really getting it funny.
Some of the expensive drugs are not covered by this insurance scheme. That's only where we have some handicap. There are some people who may not have enough money to buy some of the expensive drugs, and they are referred outside. So if there's anything they could do to at least upgrade the drugs they give to patients, I think it will go a long way to helping the civil servants.
I want to get a drug, they are telling me it's not covered. And how do we know that that drug is not covered? And they will bill you for it. Like now I've gone in, they're telling me the drug is 800 naira, whether they are to book me or not. So they're supposed to make people to know the drugs and the things that they are covered in the hospital, because a patient who is sick cannot go about trying to find out which and which this insurance scheme covers. It's not possible. And somebody who is lying sick will be going up and down. So that they should detail people which drugs, what and what are they supposed to do in the hospital, that these things are covered by insurance scheme. Because so many people are ignorant of this. Now they told me they will put a number and said call them to know whether this thing is covered. When you call that line, it doesn't go. Okay? So how do we do it? Will I leave what brought me to the hospital to begin to call insurance scheme that's on a particular drug, maybe on a spray, maybe on operation? I mean, they should detail people to know what they are covered and what they are not covered.
At the Maitama District Hospital, staff of the health insurance scheme, who say they are the middleman between their release and the HMOs, want the challenges faced from their end to be addressed.
Some of the things that bring up issues, lack of authorization code. The HMOs don't send their code on time, and some of these HMOs, they give us a lot of headaches in this Maitama District Hospital. If doctor writes patients diagnosis going for so test, the HMOs will tell us that it does not cover. The doctor will even come by herself or his or herself that, how can you tell me PUD does not cover for H. pylori? So I don't know, maybe they will be asking us that is it doctor that are giving the code or who is giving the code. So that code issue is giving a lot of problem and is making patients to be delayed.
When we are asking the patient, go back to the doctor, get diagnosis, your HMO is saying this won't go, they get upset because it's not easy walking up and down when you are sick and you are not getting what you want to get. The stress is just on them and they are complaining about that. If they can reduce that for the patient so that they won't have to go through that stress. Sometimes we ask patients to use their phones to make the calls because of the time frame. The time the HMO takes to generate the code, when we tell the patient to call the HMOs themselves, it's more easier for us because they respond to patient faster. And some enrollee will tell you, I cannot use my phone, it is not my job, it is your job. And when you now say, okay, let me do my own job, and the patient will start complaining about the delay, which is not our own fault. So we advise patients, you can call your HMO, lay your complaints to them, you have the right to do that.
I think FHS should try to review the tariff, especially for drugs. You know, most patients come in and complain that so thing is not covered under the scheme, this and that they are covering just cheaper drugs and the rest. But I believe, I know FHS is actually doing their best to sort that out and to make drugs available for these patients to use. So I believe they should try and work on that. It's very, very important because it will help us reduce the complaints we get from patients every day. To help us, it will go a long way.
The MD of the United Healthcare, a health maintenance organization, speaks on the challenges being faced by the HMOs.
Whether enrollees or provider, the immediate challenge is information. Enrollees still do not understand the role their HMO is supposed to play, and they are playing in the scheme. 2, providers too don't know the role. So we are out trying as much as possible to give information, communication and education for the enrollees, for the hospitals, for the providers, everybody in the scheme. Because the regulator, which is, if you are talking of the federal, is NHIS, but if you are talking of FCT, it's FHSS, where you came from, like Dr. Dampula. So you see, the regulator is there doing their job, overlooking all of us, the enrollees, the HMOs, and the providers, the hospitals.
Similarly, the FCT HIS program manager listed some issues troubling the FCT health insurance scheme.
Basically, the issue of how to get the premium has been a lot of issue. It's easier for the public sector because that's a low-hanging fruit. Their money is directly deducted from their salary and government pays the balance. For the informal sector, it's a little bit difficult to convince the employer of labor to pay for insurance for their staff. But that also we're going around it. And thirdly, the understanding of the public is a little bit of a challenge. People don't understand why they should pay for insurance. You know, sometimes they will ask you, if I pay for insurance this year and I'm not sick, what happens to my money? You know, but that's not the way insurance works. You know, and I ask them sometimes, if you insure your car, you know, and throughout the year your car did not have an accident, will you go back to the insurance company and say you want your money back? You know, so we need to do a lot of a lot of explanations to the community so that they know the advantages of health insurance. So, and then thirdly, because, like I said, Nigerians are not used to health insurance, there is a lot of misinformation about the advantages of insurance. People believe that insurance gives low quality services, which is not true. Insurance gives wrong drug, which is not true, and this is affecting the enrollment of some people. So we need to do a lot of enlightenment again in that direction, that the quality of healthcare being given by health insurance is not different from what you get by fee-paying patients. In fact, at some point in the history of this country, more than 90% of Nigeria will be on health insurance. It's only a very small percentage will now be paying for their pockets. So that is also a challenge for now. The last challenge is, our bill. You know, there's need to have a bill establishing an agency like this. But I'm glad to let you know that the bill has gone through the second reading. We have done public hearing and we have even done a retreat. So what we're waiting for is a third reading in the National Assembly, particularly the Senate, and we are hopeful that before the end of this 8th Senate, our bill is going to pass into law, and that will solve almost all our problems.
The controversy surrounding the health insurance scheme generated heated arguments from some women at the Maitama District Hospital.
This now has to do with hospital issues. The hospital has a lot of enrollees. Maybe you don't know the number of enrollees under any time. They have over 11,000 enrollees. Imagine if anybody cannot manage them, they should stop enrolling people. No! I still stand and I say no. If you are not satisfied with the service of the hospital, you change your hospital. If you're not satisfied.
Despite all the hurdles, the FCT health insurance scheme, which makes access to quality health care with a little premium much easier, has many benefits packages.
And there you have it. You now know that regardless of your status, once you are an FCT resident, you can benefit from the FCT health insurance scheme. And like you heard from the reports, it now covers retirees in the FCT with very little token.
deducted from the pension. Plus, the FCT health insurance scheme covers a person from 0 to 25 years, while the NHIS covers from 0 to 18 years. I encourage you to be a part of the scheme and save yourself the stress of out-of-pocket payments. Now that's all of this week's episode. Till I come your way again, same time, same station next week. I remain David. Bye for now.